Hello everyone. We will discuss today introduction to basic pathology. So some basic points which we should keep in our mind and we should understand. Those points we will discuss under this topic. So in part 1 we will complete a basic introduction to the term pathology, certain other terms and etiology and some information regarding pathogenesis. Myself, Dr. Anandas, Assistant Professor, Department of Roganidhana एवं विकृति विज्ञान, Global Institute of Ayurveda, Rajkot. So, pathology means it's a scientific study of structure and function of the body in a disease condition. We know the functioning of the body in normal way that we will study under physiology. When our body in a diseased condition or a person or we ourselves affected with any kind of disease, at that particular time we will study about that regarding the structure and functions of body in a diseased condition. For that we need the branch called pathology. It consists of the abnormalities that occur in normal anatomy including histology and physiology owing to a disease. So in a broad aspect, with respect to histology, with respect to the abnormalities present in the cells, tissues, organ system and some kind of abnormal functioning happening to the normal physiological functions of body, that also we should consider under pathology. So here everything will be in abnormal state, it will not be in normal state. Anatomy also we should include under the abnormal state, that is diseased state of body, that is pathology. It is a study of the causes and effects of disease or injury. Other than that, what are the main causes behind the disease and what is the effect over the body, or what is the cause or what is the effect of an injury to our body, what does it make over our body, that we will discuss under pathology. It involves examination of tissues, organs, bodily fluids and autopsies in order to study and diagnose disease. First of all, we should find out what kind of changes happening in our body or what kind of changes happen to our body. The cause we should find out, and then for further investigation we should go with examination. It will be boost up our strength of diagnosis also. So we should examine tissues, organs, body fluids and other autopsy studies also we should conduct to make it more confirm and diagnose the disease also. That also will coming under pathology. It is a bridge between science and medicine. So this is science dependent and meantime it is medicine dependent also, because we should find out the cause and the effect which was happened to our body because of any kind of injury or some other reasons. After that we should go with medicine also. So if at all our diagnosis is strong enough, we can implement more effective treatment to our patient. Anatomical pathology, clinical pathology and molecular pathology are the three broad subtypes of pathology. These are the main three broad classifications which we can see under subclassification of pathology. We will discuss these subclassifications in upcoming parts. General introduction to the cell, tissue and all. We know the basic structural, functional and biological unit of all living organisms, for our living body, that will be the cell. And for the tissue, a group of specialized cells which together perform a certain specific function, that is tissue. For organ, the self-contained group of tissues that performs a specific function in body, that is organ. And what does it mean by histology? Histology means the study of the microanatomy of cells, tissues and organs as seen through a microscope. So throughout the cell, tissues, organ, what kind of abnormality happen or happening, that we will find under histology. And As a result of histological investigations, we will go with further diagnosis and conclusion. How the name came pathology? So the word pathology comes from the Greek words pathos, which means disease or suffering, and logos, which means study. So the study about disease or study about the factors which is cause suffering to human beings or to the living body. That is pathology. So pathos and logos. Study about the disease. So study about the suffering. Definition of pathology, how it came. Pathology is a branch of medical science that includes the study and diagnosis of disease, mostly through analysis of tissue, cell, and body fluids. So, in pathology, we are studying about the cause, effect, and further we will diagnose the condition, or further we will diagnose the disease. So, this is the branch of medical science. We will study and then we will diagnose. Depends upon that study and depends upon the scientific evidence. We will diagnose the disease. How? Through tissue analysis, cell analysis, and body fluid analysis. Further subdivisions or sub-steps or sub-methods are there for analysis of each three types of categories. Pathology also includes the investigation of the causes of a disease and associated changes at the level of cells, tissues, and organs, which in turn gives rise to the presenting signs and symptoms of the disease. So pathology, it will be a study of causes, signs, symptoms, and further we will go with the diagnosis also. So all will come under the umbrella of the branch called pathology. After all, we are finishing with the causes or the certain study, theoretical study about a disease. Then we should go with proper diagnosis. So for that we need investigation. So we will investigate the causes of a disease. And at cellular level, tissue level, organ level, what kind of changes happen. Anyhow, it will be abnormal changes only, because if it is in normal level, it will be physiological only. There will not be any kind of abnormalities present in the body of patient. If it is a diseased condition, it will be abnormal only with respect to the physiological functioning and at different levels of our body like cells, tissues, and organs. So because of these kind of abnormal functioning or abnormal changes will cause some kind of changes in our body, and this will reflect in our body as presentation of signs and symptoms. So any kind of association of or any kind of changes happening in cellular, tissue, organ level, that will give rise to signs and symptoms. So as a result of that, in our body, signs and symptoms will appear. So a particular cause will be there. Because of that cause, some kind of changes will happen in our body that will be completely abnormal, and because of that association between cause and because of the change happen followed by that cause, some signs and symptoms will happen or will appear in our body. So constitutively, the signs and symptoms will point towards to a particular disease. So the disease also we should diagnose. That is the next step. Whenever we will study regarding pathology, two main terminologies, etiology and pathogenesis, these two terms we will keep in our mind. Etiology, which means origin of a disease, including underlying causes and modifying factors. So for the manifestation of a disease, for origin of a disease, some causes will be there. And along with that causes, some modifying factors also will be there. Most common diseases are caused by a combination of inherited genetic susceptibility and various environmental triggers. So the causes, if we consider, that will be genetical also. Along with that, some environmental triggers also will be there. So environmental triggers we can consider as modifying factors. So most of the conditions, and in a person there will be genetic susceptibility condition, which means already in a person or in the body of a patient there will be chance of occurrence of a particular disease because he has inherited or she has inherited it from his ancestors. If a person already developed with a disease, there will be chance if she or he has inherited it from his or her father, mother, or through the, if we check the familial history, there will be a role or there will be chance of this kind of genetically related diseases. So role of genetics we should consider first for any kind of disease manifestation, because the role of genes and the nature of the chromosomes will play a major role there, because This will boost up the formation of disease in a person. Along with this genetic inheritance or genetic susceptibility, environmental triggers also will play another role, because if at all a person is inherited, a disease is inherited from his ancestors or from his father, mother, from whoever it may be, at present how he or she lives and how or she or he is exposed to the external environment, the environmental factors also will play a major role in disease manifestation. So genetic as well as environmental factors will play a major role in manifestation of disease. So these 2 points we should consider under etiology. In pathogenesis refers to the steps in the development of a disease. So complete development of a disease will happen in stepwise manner, from the exposure with the causative factors till the manifestation of the complete signs and symptoms, or a disease attain the complete stage of manifestation. The complete journey in between these two endpoints will be considered as pathogenesis. It describes how etiological factors trigger cellular and molecular changes that gives rise to the specific functional and structural abnormalities that characterize a disease. So, in pathogenesis, what we will discuss, how the etiological factors. Anyhow, there will be exposure with etiological factors. A person will be getting exposed with etiological factors. It can be genetic along with the influence of environmental factors. This will trigger cellular and molecular changes. At the cellular level, tissue level, molecular level, this will cause some kind of abnormality because of the exposure with the etiological factors. That will be in different levels. Because of these changes at cellular and molecular level, will go for further functional and structural abnormalities. So with respect to a cell, with respect to a tissue, with respect to an organ, the function of that particular cell or the structure of that particular cell or the function of that particular organ, structure of that particular organ will be become abnormal. So that we will consider as a diseased stage. At the level of different conditions, if we consider the conditions of these kind of points also, this will cause formation of a disease. So that we will discuss under pathogenesis. So with respect to normal epithelium, there will be dysplastic ACF, adenoma formation will be there. From there it will cause as a result of intermediate components like KRAS along with DCC, SMAD2 and SMAD4. There will be intermediate adenoma. From there it will go for late adenoma. This will cause carcinoadenoma with help of P53, and this will end up with a metastatic condition. Just a generalized example what we will happening under carcinomatous or metastatic condition, especially in cancerous condition, from a normal epithelium till formation of a metastatic stage. So these kind of cellular changes will be happening. So the complete stages which will be happening in between these we will consider as pathogenesis. Here we will finish the general introduction regarding pathology and what does it mean by etiology, what does it mean by pathology. In upcoming parts, we will discuss different classification of pathology. We have already seen different classifications are there: anatomical, clinical and molecular. So under that, the other subtypes also will be coming. That subtypes along with the narration of that subtypes we will discuss in upcoming parts of this same topic, and the general terminologies also.